Hi, so just talking about running injuries this week. So what I want to look at today is one that is quite a tricky one to deal with and can be quite a tricky one to treat, but I thought we'd have a look at good old shin splints today. So shin splints are often, they're just regarded as pain on the front of your shins, on your tibia. So in your lower limb, there's your foot, then you've got your fibula, which is your long thin bone on the outside, and there's the bigger thicker bone in the middle, this is your tibia. So what you tend to find is with runners especially, and it sometimes happens people do a lot of hiking, an awful lot of walking, is what they start to get is the bottom 2/3 of the shin is they start to get pain up and down that border. Now, it might not be sort of widespread pain, it can just be small little pinpoint areas that are quite painful, and they can then, or it can be a little bit wider, a bit more widespread. But it's often quite a difficult one to go and treat. So I thought what we'd do today is discuss what are the factors involved in it, and then really give you an outline of what you need to do to try to get it better. So what's happening with these shin splints? So your typical shin splints, or medial tibial stress syndrome as it's known, is a bony stress reaction. So bone is a dynamically active tissue. When we're running and when we're walking, what tends to happen, especially at the tibia, is there is a little bit of deformation, so there's a slight little bend, and then it straightens back up. So when it sort of bends, gives it this ability, it's an elastic component, if you like. And when it does that, the bone then can react, it can remodel, and it can adapt to those stresses, and it gets stronger. But sometimes, and it often happens when there's too much load put on too quickly, like people suddenly increase their running volume, or they start running with backpacks on, or maybe they've just embarked on a fitness program, it might be more walking, that it's too much for the bone to cope with, you kind of tip in that balance, and the rate of remodeling is outweighed by the amount of sort of small areas of focal sort of stress that's put on the bone. And that's where you start to develop these stress reactions. And when you look at them under sort of imaging, sort of MRIs and stuff, or CT scans, you might see areas of like periosteal inflammation, which is a skin covering the bone. It's finely innervated by a lot of nerves. Sometimes in some people you'll actually see areas of bony edema, which is like a swelling within the bone. And then later down the line, you can develop little small stress fractures, so tiny little cracks in the bone. So that's how it sort of goes. So the risk factors for this kind of problem that we can certainly do, or you can do an awful lot of, seem to be the primary four are increased navicular drop. So if you've ever talked about people's feet and they're overpronating, going like that, they tend to find that sort of pronation, if you're dropping by about more than 10 millimeters, that tends to be one of the risk factors. Another risk factor is, we've talked in the past about dorsiflexion of the foot when the foot goes up, but plantar flexion. So increased range in plantar flexion, basically what that does is it means you're on this sort of what we call the push-off phase of walking or running longer, and that seems to put an awful lot more stress coming through that tibia as well. Your hip and your tibial rotation are really important. So if people have got an awful lot of internal rotation at your hip, so when the hip turns in the way, tends to suggest the muscles aren't strong enough, and then that creates a sort of a rotational or torsional force further down, and that affects the bone as well, and that can affect how it heals. And then on top of that is this like body weight. So I mean, like, it doesn't even matter if you've just started running. If you started running and you're actually using extra weight, so people that are running with backpacks on, say they're doing like fitness tests for getting into the military or the services, all those things have an impact on what happens at the bone, and it's basically the bone is struggling to adapt to the force you're putting into it, and it can't adapt quick enough, so then it starts to get painful. Now, the difference between sort of shin splint pain and other sort of lower limb running injuries is that unlike a tendon or muscle, you tend to find, especially the chronic tendons, as people get up, like Achilles, or even plantar fascia, and once they start moving, it's painful, but the more they move, the better it gets, and it actually eases off. And some of these people can actually run through it and feel okay. With the bone, the more impact and the more loading you put on it, the sorer it gets. So it doesn't respond in the same way to exercise. It's actually more exercise makes it worse. And this is where we've got to start getting our rehab right. So the best way to deal with this, number one, it comes down, going back to your shock absorbers again. So you need your shock absorbers in your body to be strong and to be effective. So your calf complex, your quads, and your glutes are really important to help in the prevention of shin splints. By doing that, you're getting the muscles stronger, but you're also helping to get the bone stronger by any sort of loading sort of regime. And this is also important if you're suffering from shin splints, getting back to running, actually doing these low load or sort of low impact exercises will actually help to stimulate the bone to get stronger as well. So that's the first thing you want to sort of have a look at. The other thing we want to do with our shin splint patients is work out how much impact they can take. What we do know about bone is bone tends to respond better to little and often low doses of exercise, especially with these kind of bony stress injuries. So not doing like sustained over a long period of time, and they tend to like the impact stuff better as well. So things you've got to look at is how much impact can the shin splints, can the shins take? So things like, are we able to sort of do double foot jumps without any pain? Can we do a little bit of running on the spot without any pain? Can we hop? And sort of develop it from there, even up to more sort of plyometric like exercises like bounding, hopping, skipping. Because once we can find the level that we can tolerate, then we can introduce that back into your rehab, and that gets the bone fitter and stronger for what you want to do. So we're really just trying to develop the resilience and the tolerance of that structure. So hip strength, impact loading, so we can take load, is really important. If we've got problems down about the forefoot, especially with that navicular drop, then we can start looking at, is it worthwhile doing sort of forefoot exercises to try and get the intrinsic muscle stronger. But it may also be, we need to look at your footwear, check with the podiatrist to see if we can offset that and get that working. So that's a little insight into shin splints. We'll have a blog up on the website about that soon, and then we'll look at some exercises about how we maybe assess or like progression of how we go through for some impact loading. Hope you found that useful. Hope you don't have shin splints, but if you do, feel free to give us a call at the clinic. We're always happy to help you, to get you back on track again. I'll speak to you soon. Bye-bye.